The crush of COVID-19 cases is filling up hospitals and taking a toll on healthcare workers. And today, Missouri Governor Mike Parson said help is on the way. Our Casey Nolan reports on a new plan to bring in backup from other states through a contract with a private company.
The warnings are now reality. According to the St. Louis Pandemic Task Force, hospitals are filling up because of COVID. In the St. Louis area, more than 80% of beds hospitals can staff are full, and nearly 90% of the staffed ICUs are occupied with patients. The head of the task force says St. Louis area hospitals are now sending some patients home who would normally be admitted.
And that's not just for COVID patients, that's for across the board. And the reason for that is we have precious little capacity now. We believe that we need on the tunes of several hundred nurses and techs in order to meet our demand just right now.
We have plenty of hospital beds available. The issue is that there aren't enough doctors and nurses to staff these beds.
Wednesday, Governor Parson said reinforcements are on the way. He says Missouri will work with a private company to bring in up to 760 additional nurses and other healthcare workers, enough to increase hospital capacity by 600 beds statewide. For now, it's a 12-week plan, with the state picking up the tab with CARES Act money through the end of the year, and from there, hospitals will have to find the funding. And after 12 weeks...
Well, I think it's just the first stage of it. I don't know that it won't be 6 months. I don't know it'll be a year. I don't think any of us knows where we're going to be in 12 weeks.
But where will these hospital workers come from, with just about every state dealing with a surge? Well, no specifics on that, except that the state has already waived certain regulations to honor medical licenses from other states. The governor couldn't yet say how much this will cost either. Casey Nolan, 5 on your side.
Now, the head of the Missouri Hospital Association said at today's announcement that travel for recreation and retail in Missouri was up 40% over Thanksgiving, and that has them worried about the strain on hospitals over the next couple of weeks.